Yeah, you mentioned fertility, and I know your focus is very much on that. I wondered if you might just comment on what is, because it's a big issue in our society, isn't it? I mean,
Yeah,
people decide, oh, I'm going to have a baby when I'm X, Y, or Z years old.
yeah.
It doesn't always work out that way, does it? What's the statistics on fertility in Australia or globally here,
Well,
for
the,
people?
the global birth rate is declining. Yeah, so
Hmm.
it's declining and it's now under the reproductive rate in certain countries around the world. And there are suggestions that it's that infertility is greater and challenges in pregnancy is greater, but it's also choices. People are choosing to have smaller families and or not choosing to have children. So I think it's tricky to understand it, but definitely in Australia, statistically, numbers of birth are declining, quality of sperm is declining, average age of mother is getting older, average exposure of couple is getting greater, and the complexity of the challenge of conceiving is greater. But then also IVF is statistically increasing, and not to badmouth IVF, and I want to support everyone to have their family, but we have a lot of data that shows that IVF increases the risk of diseases in children. We have a lot of data that shows that if a couple can't conceive naturally and need assistance, whilst the assistance can give them a baby, maybe nature was suggesting you can't conceive because we can't create something as healthy as possible. And then all of a sudden they're creating children, but they've got higher chance of asthma and neurological disorders and, all the atopy and all of that sort of stuff, because perhaps IVF intercepted to create that baby, but actually it made it more of an issue.
Yes, we could be open. No, we could be opening a can of worms here, but of course, this is part of a much bigger story about business model within healthcare.
Yeah.
And I mean, if I wonder whether I've never been obviously to an IVF clinic, but I wonder whether the preparation, of the IVF, because the business model is this is going to cost you X amount of dollars per IVF thing. So there's a conflict of interest there with getting a high success rate,
Yep.
one could argue,
Yep.
and setting the foundation for that success would say, well, just go away for 3 months, 6 months, 12 months. Let's lay down the foundation consciously
Yeah.
of what we're trying to achieve, then come back and see us for IVF. And
Yep.
lo and behold, I wouldn't be surprised if
They
people
don't
got
always need
pregnant.
it. They don't
Yeah.
always need it. I mean, the clinicians that I work with mainly, particularly in Australia, they're very much of that model, because for them it's about healthy babies. It's not about necessarily IVF numbers. But the business end of IVF definitely wants the IVF numbers. So I get it. And it's complex. And again, both of us are here to support people to have families. There's no judgment, but
No.
yeah, it's a complicated area.
It is a complex and a very emotive
Very,
area too.
very.
But I've heard statistics, because we've done quite a few podcasts on fertility, and one I recall, the statistics was something like 1 in 6 couples are finding
Yes.
it challenging. Is that still the
It's
current?
steady, yeah. And miscarriage is 1 in 4. So one
One
in
in
4
4.
conceptions end in miscarriage, and 1 in 6 couples. Well, the fecundity, they say, is only a 1 in 6 chance for every couple generally, and then you add complexities, and then it becomes trickier. But 1 in 6 is the baseline from a fertility rate.